Greetings and thank you for joining our Well-Connected Communities presentation of Improve Your Community's Health Through Equitable Food Access. My name is Dr. Thomas Ray, and I will be uh, walking you through the presentation today. Please note that you also have access to these slides as well as the links that will connect out to the various applications and resources. Also, you have the study guide with questions and additional resources for your convenience and use as hopefully your community joins us in this effort to improve community health through equitable food access. This project is a presentation of part of the work that's been done by the National 4-H Geospatial Leadership Team and our Where's the Food project. The Where's the Food project includes young people in 4-H from across the United States at the community level who have been doing work to address food security, food access, food systems in their local community, utilizing geographic information systems through preparing and presenting maps, as well as developing web-based mapping applications to better inform policymakers as well as community members about food access in their community. We're hopeful that you will take some of the ideas and lessons that we've learned from our approach and implement them in your own communities. We're going to invite you at the end of the presentation to join us and see if you might have some 4-Hers in your community that would want to be a part of this process and part of the Where's the Food project. Sometimes when we talk about equity and equitable food access, it can be confusing, it can be paralyzing, it can leave us wondering what's actually meant by that. I want to start by just discussing some definitions of equity in such a way as hopefully to move from paralysis to empowerment in utilizing an equity lens and an equity-based approach in your work as you address food security in your own communities. I want to start by looking at the concept of equity as outcome. Many times in the news or other publications, when we talk about equity or we say something is not equitable, or we look at disparities, we're talking about outcomes. And what I mean by that is, I'll give an example. If you can predict someone's likelihood of having, let's say, heart disease as the example, based on their race, ethnicity, or socioeconomic status, then there's a disparity there. That would not be an equitable outcome. Or if you can predict based on someone's race, ethnicity, or socioeconomic status, their likelihood of graduating from high school, then we would say that is not an equitable outcome. We would say that's a disparity. So when we talk about equity as an outcome, our ultimate goal there is to eliminate that ability to predict an outcome based on race, ethnicity, or socioeconomic status. In other words, those factors would not be something anyone could use to say, oh, well, you're more likely to have this negative outcome or this positive outcome based on those factors. And the fact that we have disparities for individual communities based on race, ethnicity, and socioeconomic status is a systemic issue. And we did not get to these problems overnight. So many times when we talk about equity as outcome and we think about trying to be equitable in our work, it can become overwhelming because just as a switch was not flipped to get us there, a switch cannot be flipped to get us out of there to a place where you cannot predict based on those factors. And so while equity as outcome is our ultimate goal, and we do want to keep that in mind, I want to encourage you instead to focus on equity as practice. What are you doing in your daily work tied to policies, tied to practices, tied to programs? And can you, instead of focusing on something that may be more difficult to control, focus on what you can control in terms of those daily practices, again, related to programs, policies, and practices. So, one of the strategies that we can use for equity as practice, and the one that we're going to spend some time presenting our approach in our communities today, is community voice. Many times within programs that we intend to do positive things or make a positive impact in our community, we do a needs assessment, and then we generate some strategies, and then we implement those without really soliciting community voice or community input. Well, that's not really equity and it's as practice, and it's not really informed decision making. I want to note over here that I'm in Wake County, North Carolina, and you see here our newest food security plan model. And at the very beginning, on the outer rim of this work, leading ultimately to community resilience, and we'll talk more about that towards the end of our presentation when we talk about resilience and food for all. On the very beginning of this, the very outer rim is equity and informed decision making. And so it's important to think about the role of community voice and how community voice cycles and needs to feed through every one of these rings in this step of this process in order to get us to our desired outcome, which of course will be an equitable outcome at the end of the day. But notice tailored services, tailored based on community voice and community feedback. Increased storage efficiency and equitable service. It's really important that we think about folks' experiences with our agencies and organizations. Are they experiencing our agencies and organizations in a way that matches with our mission and our vision as an organization? And then again, back to equity and informed decision making. So community voice really needs to be felt along this process if we're actually going to get to our equity as outcome. And so I'm going to back up just a little bit and walk you through our steps that we took to address food security in our community. And again, I make it sound like we're done. Recognizing that this is an iterative process is also important, and constantly receiving feedback from our community and constantly taking that and using it to improve our policies, practices, and protocols. So first, our first step was evaluate your community. And so we really wanted to take a look at what existing data there was for our community. And in order to assist you in this, again, in your resources and materials, you'll have access to this. We developed a data exploration application that you will be able to utilize in your own community. And so I'm going to go ahead and pull it over here so you can take a look at it. This is set up in such a way that we did use nationally available data. The data is available at the community level. So you can click on this search magnifying glass icon here. Go here, type into your community. Again, I'm in Wake County. I'm going to zoom in here. The first thing we see on the application is this food environment index. And so when we take a look at the Food Environment Index, this is from the Robert Wood Johnson Foundation's County Health Rankings. We can go ahead and click in here and learn a little bit about the Food Environment Index. It does account for both proximity to healthy foods and income. And so an index just takes multiple variables and combines them in a way that you can make sense of a few variables at the same time. And in particular, for the food environment index, it ranges from 0, which is worst, to 10, which is best. Wake County scores an 8. You can see what some other counties in the area have. This is a 6.8. Up here, Halifax County has a 5.4. But these are based on rankings from across the United States. So you'll be able to look at your county and see how your county ranks as well. I do want to note that over here on the left, the second button down says layers. If you click here, you can actually turn off the food environment index, and we can come back in and look at some other variables. So for example, we also have our Where's the Food survey here. Again, I'm going to encourage you at the end of the presentation to engage your community with the Where's the Food survey and add some of your own local food access points to the survey. We can also look at SNAP store locations. I want to note that SNAP is Supplemental Nutrition Assistance Program. So these are store locations that will accept SNAP benefits. Oftentimes those show up as an EBT card. But I also want to point out that while some of these locations are grocery stores, some are not. And so we have a combination of a Dollar Tree and a Big Lots, but then there's a BJ's Club. We had an Aldi, which is a grocery store. But it's important to note that not every SNAP location, like Handy Hugo's, would actually be a gas station with a convenience store. So not every SNAP location necessarily means that folks have access to fresh fruits and vegetables. We also have an option to view these as a heat map, so you can see where those concentrations of the stores are. And you can start to notice some patterns about, well, where are locations where people have lower food access? So we've got a food access map by county, and do you see some patterns here? Or how about school neighborhood poverty estimates? Do you see any patterns here? So looking for patterns and trying to make sense of this data is going to be part of your work as you really start to evaluate your community. What do you notice in terms of patterns? But then also, what data is missing? And so I'm going to close that out and talk just a little bit about, again, our journey when we started facing COVID. So back in March and April of 2020, here in Wake County, we like many other communities were faced with a lot of uncertainty and recognizing that there was a lot of need. in our community. Wake County has, I believe, around 1.1 million residents now, and we're growing at a rate of 67 net gain per day, which means there's a lot of people, so a lot of resources, but also a lot of need. And we worked with our Wake County Public School System social workers, North Carolina Cooperative Extension, Wake County staff, as well as Wake County Health and Human Services staff, and our other Wake County Public School System staff to identify where need existed in our community. So what you see here on this map, first of all, these little dots with the little purple splashes around them were the pre-COVID uh, locations where people could access food, who individuals in need could access food. So these are our food pantries, um, and options for food banks, those types of things. These polygons, so we took the individual needs that we gathered from our partners and mapped all those in and aggregated them, which means that you can't tell exactly where somebody is, but we put all those needs into these polygons, where the lightest polygons have closer to one individual, but higher numbers of individuals with needs are in these darker purple polygons. And what you'll note is some of these darker purple polygons do not have the resources within those polygons. And so we were able to see there are parts of the county um, where we needed some additional resources. And so we collaborated with our Wake County food security manager, updated our food security plan, and mobilized our school system food and nutrition services, our community partners, and ensured, and you'll see another map a little bit later on that shows that all of these areas where there's need, um, we grew from these number of food outlets to hundreds, and you will see that in a future map. But all of that was to point out that we still had some other questions. There were still some things, even as we did those food distributions, and again, we were moving quickly. We knew people were in need, but we really had some other questions based on our data, based on conclusions we had drawn. We wanted to know from an individual's perspective, is it easy to use the food they receive to prepare a meal for themselves and their family? How about the ingredients that are in the boxes, the food boxes? Those ingredients provided align with traditional dishes made in the home? And what other types of food would best match families' needs? And so we used, so our next step was after, again, evaluating our community, identifying what we didn't know, but wanted to know. We used Survey 123, which is another GIS product, which again, if you join our 4-H work, we will be able to get you access to these resources. But we developed a survey to ask some of these meaningful questions, understanding who these individuals were in terms of demographics, and then how was their family being impacted by food security issues? And this question here about in the last 12 months, have you or anyone else in your household ever cut the size of a meal or skipped a meal because there was not enough money for food? This is one of the key questions for understanding food security. And I'm not going to go through the whole survey right now, but in the materials that you'll have access to, you'll be able to go through the survey or a copy of it and see the types of questions that we asked. I want to also point out that we did multiple rounds of administrations. We went across the county to different food hubs, but we also recognized that we were pretty much learning as we were going. And so we recognized that we had to do some revisions. And I'll talk more about that in a minute. But I do want to talk about how we administered the survey. So we decided that we had to get out there in the community and collect that data. And we tried a few different approaches. We tried sending out the survey to our food hub partners and asking them to send them out through their communications mechanisms. That wasn't really successful. We tried providing QR codes and short links for people to complete the surveys themselves. That wasn't really successful. What we ended up finding most successful was actually going to the food hub sites and talking with people while they were in line. And our food hub sites distributed different ways. Some had people in vehicles, some had people standing outside of their vehicle but in a line. And we would go ahead of distribution start time because in our community, folks were lining up early before distributions actually began. And so we found that that was a prime time to start asking questions. But all that to encourage you to make sure that whatever your data collection approach is, that it fits your community. Your processes may be different, but be willing to adapt and try different approaches. It's really important to get community voice to make sure that you are the work that you're doing is having the helpful and not harmful um, impact. And so the next, after we did our data collection, well, first let me point out that, as I mentioned before, we did have to adapt our questions multiple times. We made updates, but then we also were able to uh, find areas that were challenges for folks. And so we're going to actually take a look at our story map here. And again, you have a link to this, and and you can just scroll through. A lot of this is the data that I've already covered with you. You know, again, here's that need data that we looked at earlier. Here's the response. You know, I mentioned that our food security manager responded quickly. All of these points represent food distribution sites throughout the county. We were distributing in neighborhoods, some door to door, depending on the mobility and needs of the community. Here you see how it ties back to our food security plan. Here was our initial survey. We actually revised the survey and did a set. Here are our young people, our 4-Hers out collecting data. Some we don't see any collecting the cars, but they're all in a line here. But we collected some just walking alongside vehicles as they were in line. You'll actually be able to take a look at the survey itself whenever you access the story map. Here's the distribution of our second administration. A few of the key findings here, when people are talking about they're skipping meals, we see some of that data here. The red indicates that they had skipped a meal. Um, we looked at types of food that people eat in their homes. We also asked them, does the food they receive at the hub meet what they typically eat? And you'll note that most people agreed or strongly agreed. So our food hubs were being very responsive. And then we asked people what they'd like to see more of in their boxes. I'm not going to take time now to go through all of those because you have access to review this data on your own. But you'll see even the breakdown of these types of foods that people wanted to see more of. So you have access to that to understand more about the our process and how we really did our best to solicit community voice. And we're probably not finished. That was our second administration. And we'll continue to do this work. Uh, Back on the model that we looked at the beginning, in the middle was resilience. And when we talk about resilience, we're talking about communities being resilient, being able to respond to challenges. And again, I'm not going to show this video because you have access to it, but our Wake County, or excuse me, our North Carolina Association of County Commissioners um, had this video developed to look at strategies for addressing food security in communities. And so I really encourage you to take a look at this, and you'll see some different strategies that were used here in North Carolina. One other project that a young person did in our group was they did take a look at student and family resources for food. And again, this includes our multiple programs, including backpack buddies, school pantries, food pantries, and more. So you'll have a link to that in your slides as well. And finally, I want to ask you to consider joining us. Clicking on www.where'sthefood.us will bring you to our website. You can access the Where's the Food survey as well as the dashboard. And so again, consider how you might engage young people in your community in this project. And ultimately, we hope you will get involved and join us. So thank you for joining me for this presentation on improving your community's health through equitable access. And again, please consider joining our work.